Mr. President, I'd like to make a statement regarding my vote in committee on behalf of Robert F. Kennedy to be the Secretary of HHS. First, I thank everyone who has contacted me over the last few days. Almost all have been respectful and seek the best for our country. And I've been contacted by text, by phone, by email. And if I didn't respond to anyone, it was not to be rude. It's just I was getting hundreds of messages a day personally and thousands through the office. And I just physically could not. Now, Mr. President, believe it or not, of these hundreds of people calling me and contacting me, however they did, many of them disagreed with each other, diametrically. Three-dimensionally, they disagreed. But the unifying factor is that they all desire the best for our country, even though they differ from each other so much. And maybe that kind of frames my feelings about this nomination. For context, before entering politics, before ever thinking about running for political office, I practiced medicine for 30 years in a public hospital for the uninsured, caring for those who otherwise would not have been able to afford the access to the care that I provided. After seeing patients die from vaccine-preventable diseases, I dedicated much of my time to vaccine research and immunization programs, personally witnessing the safety monitoring and the effectiveness of immunization. Put simply, vaccines save lives. This is the context that informed me when considering RFK as the nominee to be Secretary of the Department of Health and Human Services. It was a decision I studied exhaustively, I took very seriously. And as I said I would, I spoke with Mr. Kennedy not once, but multiple times over the weekend, including this morning. We had in-depth conversations about the medical literature, about the science behind the safety of vaccines. He referred me to studies and to people. I reviewed them and spoke to those whom he mentioned I should speak to. Now, the most notable opponents of Mr. Kennedy were pediatricians on the front lines of our children's health, who regularly have to combat misinformation, combating vaccine skepticism with correct information that comes from their education, their training, and experience as physicians. They are aware of the falling vaccine rates and the inevitability of increasing hospitalizations and deaths of children from vaccine-preventable diseases. They are aware that children are now contracting diseases that they would not have contracted if the child was vaccinated. Now, I heard from others impassioned about the need to address chemicals in our food and a belief that we are victims of large impersonal forces maximizing profits while sacrificing our health. And there is evidence for that. Although food safety is principally a USDA concern, I strongly agree that this is an issue society must address. Other RFK supporters are concerned regarding environmental risk. They fear these risks are being ignored by authorities. Mr. Kennedy's history of environmental activism motivates their support. I pointed out that the Environmental Protection Agency monitors this, not the Department of Health and Human Services, but they still feel that he can make a difference. So as I looked how to resolve this, I returned to where I began. Would it be possible to have Mr. Kennedy collaborate in helping public health agencies re-earn the trust of the American people? Now, regarding vaccines, Mr. Kennedy has been insistent that he just wants good science and to ensure safety. But on this topic, the science is good. The science is credible. Vaccines save lives. They are safe. They do not cause autism. There are multiple studies that show this. They are a crucial part of our nation's public health response. But as someone who's discussed immunizations with thousands of people, I do recognize that many mothers need reassurance that the vaccine their child is receiving is necessary, effective, and most of all safe. While I'm aligned with Mr. Kennedy as regards ultra-processed food, reforming NIH, and taking on chronic disease, once more, it leaves vaccines. Now, Mr. Kennedy and the administration reached out seeking to reassure me regarding their commitment to protecting the public health benefit of vaccination. To this end, Mr. Kennedy and the administration committed that he and I would have an unprecedentedly close collaborative working relationship if he is confirmed. We will meet or speak multiple times a month. This collaboration will allow us to work well together and therefore to be more effective. Mr. Kennedy has asked for my input into hiring decisions at HHS beyond Senate-confirmed positions, and this aspect of the collaboration will allow us to represent all sides of those folks who are contacting me over this past weekend. He has also committed that he would work within current vaccine approval and safety monitoring systems and not establish parallel systems. If confirmed, he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes. CDC will not remove statements on their website pointing out that vaccines do not cause autism. Mr. Kennedy and the administration also committed that this administration will not use the subversive techniques used under the Biden administration, like sue and settle, to change policies enacted by Congress without first going through Congress. Mr. Kennedy and the administration committed to a strong role of Congress. Aside from he and I meeting regularly, he will come before the Help Committee on a quarterly basis if requested. He committed that the Help Committee chair, whether it's me or someone else, may choose a representative on any board or commission formed to review vaccine safety. If he is confirmed, HHS will provide a 30-day notice to the Help Committee if the agency seeks to make changes to any of our federal vaccine safety monitoring programs, and Help Committee will have the option to call a hearing to further review. These commitments and my expectation that we can have a great working relationship to make America healthy again is the basis of my support. He will be the secretary, but I believe he will also be a partner in working for this end. If Mr. Kennedy is confirmed, I will use my authority as chairman of the Senate Committee with oversight of HHS to rebuff any attempt to remove the public's access to life-saving vaccines without ironclad, causational, scientific evidence that can be accepted and defended before the mainstream scientific community and before Congress. I will watch carefully for any effort to wrongfully sow public fear about vaccines between confusing references of coincidence and anecdote. But my support is built on assurances that this will not have to be a concern, and that he and I can work together to build an agenda to make America healthy again. We need a leader at HHS who will guide President Trump's agenda to make America healthy again. Based on Mr. Kennedy's assurances on vaccines and his platform to positively influence Americans' health, it is my consideration that he will get this done. As I've said, it's been a long, intense process, but I've assessed it as I would assess a patient as a physician. Ultimately, restoring trust in our public health institution is too important, and I think Mr. Kennedy can help get that done. As chairman of the Senate Committee with oversight authority of his position, I will do my best to make sure that that is what we accomplish. I want Mr. Kennedy to succeed in making America healthy again. His success will be tied to the health of our nation. He has the opportunity to address the most pertinent issues affecting Americans' health. We also need to reform institutions like FDA and NIH, and those, as already been indicated, are my priorities as chairman of the Help Committee. I look forward to his support in accomplishing this. If confirmed, I look forward to working together with Mr. Kennedy to achieve President Trump's mission of improving the health of all Americans. And with that, I yield.